Here are 4 multiple-choice questions based on the provided sources and our conversation history, along with the answer key. Welcome to another episode from the Veterinary Medicine Digest. Today, we delve into a fascinating case report about a young French Bulldog puppy that shed light on a rare and often underdiagnosed condition in canines, congenital hypothyroidism with goiter. This condition arises from an inborn error in thyroid hormone synthesis, and critically, thyroid hormones are vital for a developing fetus, particularly for the neural and skeletal systems. Breed-specific genetic mutations in the thyroid peroxidase gene are known causes, affecting breeds such as the toy fox terrier, rat terrier, and notably, the French Bulldog. Information on advanced imaging of the central nervous system and thyroid glands in dogs with this condition has been limited. Our story begins with a 7-month-old intact male French Bulldog referred for concerning issues, abnormal mentation, and a peculiar gait that had been worsening over 2 months. This puppy had a challenging start. From a litter of 7, 5 of his siblings had already passed away from unknown causes, all being underweight. At presentation, this puppy himself was smaller than average for his age, weighing just 5.75 kilograms. A physical examination revealed several key findings. A disproportionately large, rounded head with a palpable persistent soft spot, bregmatic fontanelle, a short, thick neck with a noticeable soft tissue enlargement in the thyroid gland region, and dermatological signs like thinning haircoat and dry skin. Neurologically, he displayed mild dullness and uncoordinated gait affecting all 4 limbs, weakness in his hind limbs, and a mild bilateral squint, strabismus. Blood tests unveiled low levels of total thyroxine and free thyroxine, alongside normal thyrotropin concentration. The underlying cause was confirmed through a genetic test which identified a thyroid peroxidase mutation, indicating the puppy was homozygous for the mutated gene. The next crucial step involved magnetic resonance imaging, or MRI, which offered a window into the puppy's internal systems. The brain scans corroborated the physical findings, revealing a dome-shaped calvarium and the persistent fontanelle. More profoundly, the imaging showed moderate hydrocephalus, characterized by enlarged brain ventricles and thinning of the brain tissue, cerebral parenchyma, with widened cerebral sulci, indicative of brain atrophy. This type of hydrocephalus, often termed ex vacuo, suggested brain volume loss. The MRI also highlighted the reason for the palpable neck enlargement. Bilateral, enlarged, well-defined masses in the thyroid gland region, appearing heterogeneous and hyperintense on certain sequences compared to surrounding muscle. Other significant findings included multiple congenital hemivertebrae in the thoracic spine causing mild spinal curvature and narrowing of the vertebral canal, fluid accumulation in the chest cavity, and stenosis of the ear canals. Swollen C2 nerve roots were also noted. The discussion of these findings underscores the profound impact of thyroid hormone deficiency. Thyroid hormones play a fundamental role in the growth, maturation, and development of the central nervous system, influencing neuronal and glial differentiation, migration, and the formation of myelin. Therefore, the brain changes observed in this puppy, including the hydrocephalus and brain atrophy, were hypothesized to be directly associated with the lack of these hormones, mirroring findings in human cases of congenital hypothyroidism. Previous research in rat terriers with a similar genetic mutation even described hypomyelination and loss of white matter in the brain, which could explain the MRI abnormalities. The enlarged thyroid glands, or goiter, observed on MRI were also consistent with findings in human infants with congenital hypothyroidism with goiter and their signal intensity on T2. Weighted images correlated with decreased iodine concentration. The other issues, such as ear canal stenosis and pleural effusion, are also documented in dogs with this condition. Following diagnosis, the puppy began treatment with levothyroxine. Just 5 weeks into treatment, remarkable improvements were observed. The dog became more active, gained weight, and both his gait and dermatological signs improved significantly. His total thyroxine levels increased, and thyrotropin levels decreased. While some abnormal behaviors related to mental status persisted, the rapid clinical response strongly suggested that the myriad of signs were indeed caused by thyroid hormone deficiency. This case truly highlights the importance of early diagnosis and intervention in managing such complex endocrine disorders in veterinary medicine. Thank you for listening to the Veterinary Medicine Digest. The title for the reference paper is in the video description. Remember to test your knowledge by answering the questions below, and as always, Keep those minds inspired, hearts light, and tails wagging.